Hi everyone, I hope you're going well at home, staying safe and staying isolated, keeping yourselves occupied and not going too crazy, and of course staying connected with your family and friends. Welcome to my first video about labour and delivery. The Department of Health and our college, the Royal Australian and New Zealand College of Obstetricians and Gynecologists, and lots of other authorities have suggested that we try and limit the number of face-to-face medical appointments that we have, and the ones that we do have to limit the duration. So I decided to make these videos with some of the general information that I like to give people about labour and delivery. My idea is that you can watch these from the safety and comfort of your own homes, which might even be a better way of taking in this information, and rather than listen to me do it in the rooms. And then when you come in and we're speaking about labour and delivery, we can have a slightly more targeted, more focused discussion about the things that really are important to you. These discussions normally would take place over several visits in the sort of mid-third trimester. I try and break it up a little bit because I don't want people to have to listen to me bombarding them with lots of information. And also I think it hopefully makes it a little bit of a less daunting discussion. I like it to be a bit more of a conversation than a lecture. And one of the benefits hopefully in doing it this way is it will be more of a conversation. I'll give you the information ahead of time and then we can talk about it more on the day. So for the first video, I thought we'd talk about the concept of a birth plan and pain relief in labour, because they're usually the two things that are most on people's minds. I would encourage you against having a birth plan per se. I do think it's really good to think about how you want to approach labour, but you just need to remember with birth plans that we can't discuss the birth plan with the baby. There's no option to negotiate with the baby, and ultimately the baby is running the show, and you and I and everyone else are responding to what the baby does. So I really like to talk about your preferences, but I would encourage you not to have a really fixed idea on what a good delivery looks like or what it involves, especially if this is your first baby. Like any new experience, you might find that it's quite different from the way that you've imagined it. From my point of view, the overall plan is that you're safe and the baby's safe. But I also want you to walk away from the experience feeling like it was a good experience. Of course, that's very subjective and means different things to different people, which is why I think it's really important that we talk about your preferences. I also like to talk through with people the reasons why I might recommend our various interventions like a caesarean or an instrumental delivery. Not because I think these things are particularly likely to happen to you, but I think it's important that you understand how they work and why we recommend them, to kind of demystify them a little bit, in the hope that if they are required on the day, that background knowledge will hopefully make the whole process a little bit less daunting and make it a nicer experience. Regardless of what happens on the day, you and I will be talking throughout the labour. Every time I examine you, I'll tell you what I've found, what I think is likely to happen next, what our options are. And my intention is that we'll be making decisions together throughout the whole process, and through that process of being informed and being involved in your care, you'll feel calm and feel like you're in a safe environment and feel like you're in control. Before we talk too much about pain relief though, I think it's worth commenting on the fact that we spend a lot of time focusing on and preparing for the birth, which is important, but it's a day of your life. It is a big day, there's no doubt about that. It's an important day of your life, but it is a day. And from the perspective of someone who's watched a lot of people become parents and someone who is a parent myself, I can tell you that the much bigger, the much more challenging, the much more important part of all of this is taking the baby home and looking after it. That's the much bigger test of your coping skills and you as a person and you as a parent and all of that kind of thing. And I think we send people home a little bit underprepared for that, in fact, very underprepared for that. So if I haven't already given you my suggested reading list of things that I wish I'd read before becoming a parent, ask me about it next time you see me in the rooms. When it comes down to pain relief, we've got lots of options, starting from simple things and working your way up. There are lots of breathing techniques and mindfulness techniques, things like calm birthing and hypnobirthing and just general meditation techniques that work really well for some people and not at all for others. It just really depends on your personality and what kind of background you have with those kind of things. And then there are the simple physical techniques, so things like massage, hot packs, positioning in the bed or on a Fitball or on a mat or all that kind of thing. Getting in the shower can be really good, particularly in the early stages of the labour. Another sort of simple physical technique is something called a TENS machine. I think the best way of thinking about these is if they're kind of a neurological distraction technique. Sensation in your body is all electrical impulses that go through your nerves, through your spinal cord to your brain. And your brain interprets those sensations as pain or whatever the other sensations are. The idea with the TENS machine is it's delivering kind of white noise, safe electrical stimulation into your skin, usually on your back, and bombarding those pathways so that there's less room to carry other information to your brain. It distracts your brain. It works really well for some people and not at all for others. I think that people are just put together differently. Some people might have pathways that can take more information than others. Maybe some people's pathways are more susceptible to that kind of distraction than others. We don't really know why it works for some people and not others, but it's a simple thing. You can try it at home even before you come into labour, and you've got not too much to lose with that. You hire these devices, and there are lots of online companies that will arrange that for you. Some, depending on your health fund might buy it for you. Moving up from that, the sort of first of the pharmacological agents is the nitrous oxide, the old-fashioned laughing gas. It's a little bit like the TENS machine. For some people, it's really effective pain relief. Some people try it and feel that it does nothing. It does also give you something to do. You have to breathe it with each contraction. It wears on and wears off really quickly. So it gives you something to focus on and sort of regulate your breathing, which I think can be useful for some people. It makes some people feel a little bit nauseated. And it can give you kind of a spaced out head spinning kind of feeling, which some people don't mind, but some people find really uncomfortable. The next option up from that are the strong painkillers, the narcotic painkillers like morphine and pethidine. They're really fantastic early on in the labour. They don't take the pain away completely usually, but they take the edge off the pain and relax you a little bit. So they allow people to get a bit of rest in between contractions and sometimes even doze a little bit. They're great early on in the labour. They don't tend to work terribly well towards the end, so we don't tend to give them later in the labour. And they can cause nausea, so we usually give them with an anti-nausea medication. And then our big gun pain relief, of course, is an epidural, which is some local anaesthetic and a painkiller put into the space around the nerves at the bottom of the spinal cord. This is the only thing that we can offer that will completely take away the pain of labour. Epidurals do take a bit of practice to be good at, and all the anaesthetists that we have at the private hospitals where I work are specialist obstetric anaesthetists who are very skilled and very experienced, and these are excellent epidurals. What we're aiming for with an epidural is to take away pain without taking away too much other sensation. So with the perfect epidural, you'll still be able to feel that you've got a contraction. You'll still feel the uterus going tight. It just won't be painful. And you'll still be able to feel a sense of pressure and still be able to move and coordinate everything enough to be good at pushing when the time comes. We don't always get that balance exactly right. Everybody is wired up slightly differently, and everybody responds to these drugs slightly differently, just like any other drug or any other medication. But you also have the option with the epidurals of controlling yourself the amount of pain relief that you're getting and dialing them up and down a bit. My thoughts generally with pain relief, I think they're like any other medication or medical procedure. If you didn't need it, you probably wouldn't have it. But the good thing about having a baby in Australia in 2020 is that we have lots of options that weren't available to our grandmothers, that still aren't available to women in lots of parts of the world. And labour doesn't have to be a distressing experience. For some people, labour isn't a distressing experience and they don't need any pain relief, and that's great for them. But sometimes when I speak to people weeks or months or years or even decades after they've had a child, they remember it as a traumatic experience, which I think is a shame. The experience of birth as traumatic is not only related to pain relief, of course, but that's a big part of it. So I think if you're in labour and you're thinking to yourself, this is the worst thing that's ever happened to me, then have some pain relief. That's not the memory you want to take away from the birth of your first child. And I also think it's good to keep an eye on how tired you're getting, particularly if you are unlucky enough to have a longer labour. It always seems to me to be too big a trade-off if you get through without pain relief, but you're so exhausted and over it towards the end that you can't really enjoy those first few hours with your new baby. There's no right approach to pain relief. It's your labour, it's your choice, it's really nobody else's business. Nobody involved in your care is going to have an opinion about whether you should or shouldn't have pain relief. No one's going to try to talk you into pain relief or talk you out of having it if you want it. We all completely feel that it's your choice. Don't worry about what your sister or your work colleague or your next door neighbour did. It's your experience. I don't think it's as simple as pain tolerance. If you speak to women who've had lots of babies, they'll tell you that some are just more painful than others. And a lot of it, of course, is going to come down to how it all unfolds on the day. As I'm sure you can all imagine, if you have a good night's sleep, go into labour early in the morning and it's all over by lunchtime, it's much quicker to get through that without pain relief than if you have a longer labour, a bad night's sleep, or you go into labour overnight and don't sleep but take a while to establish into good labour and then are still in labour hours later. So not all labours are equal, and I wouldn't get too hung up on whether you have more or less pain relief than anybody else. I always like to know where you're coming from in terms of pain relief, but when I ask you this question in the office, I'm hoping that what you'll tell me is that you'll see how you go, play it by ear, and make a plan depending on how it all unfolds on the day, which I think is the most sensible approach. So keep that in mind when I ask you that question. I'll ask you your thoughts about pain relief, and we'll have this discussion in a bit more detail, but focus directly on you when I see you in the rooms shortly. In the meantime, take care.